So the next question is, can a patient with a history of allergic reactions receive these vaccines? And the answer is unequivocally yes. It doesn't matter whether it was an allergic reaction to previous vaccines or to bee stings or pollen or food or other medications. They can definitely receive these COVID-19 vaccines. However, they should notify the people giving the vaccines at the site that they have this history of allergic reactions, and as a result should be observed for 30 minutes rather than 15 minutes. Again, severe allergic reactions have been rarely reported with the COVID-19 vaccines. The current estimate is that it occurs in approximately 2 to 5 per 1 million doses administered, a rate that is substantially lower than that we see with many other drugs such as penicillin or cephalosporins. And as a result, it's really important for us clinicians to contextualize this low risk when advising our patients who have a history of allergic reactions. Next question is, should pregnant or breastfeeding women receive the COVID-19 vaccines? And here we should acknowledge that pregnant and breastfeeding women were not included in the original clinical studies of these vaccines. However, pregnancies did include during the vaccine trials, and no apparent adverse outcomes were seen. I want to say that the CDC does recommend that pregnant women and breastfeeding women be offered the vaccines, and they are in agreement with the American College of Obstetricians and Gynecologists and also the Society for Maternal Fetal Medicine. And it's really wonderful when all these organizations agree. And I think we need to make two important points when it comes to advising our patients who are pregnant or are breastfeeding when they're considering getting the vaccines. First is that pregnancy is now an established risk factor for more severe COVID-19. As a result, this is a group that potentially should be extra targeted for vaccination, much as we do for influenza. And second is that there is no theoretical reason scientifically why these mRNA vaccines would be harmful to either a pregnant woman or to her unborn child, or to a child that she's breastfeeding. And this is very important that we stress this because apparently on social media some unsubstantiated claims are being made about the risk of vaccination to pregnant women. So that's overall what I do is I talk to women who are pregnant and I say, look, we do offer this vaccine to you. We have limited safety data, but we have no reason to think that it's going to be harmful to you or your unborn child. And in addition, pregnancy is a risk factor for more severe disease, so strongly consider getting it. Then the next question is, what do you say to your patients who say that they prefer to wait for herd immunity prior to getting a COVID-19 vaccine? Well, here I think we can cite two very strong reasons to recommend getting the vaccine rather than waiting for herd immunity. The first is that COVID-19 is obviously a potentially very severe disease. It has a much higher case fatality rate than influenza, for example. And not only that, but survivors sometimes have prolonged post-infectious symptoms that can last several weeks or even months and be quite disabling. And the most common symptoms in these post-COVID syndromes are things like fatigue, shortness of breath, palpitations, chest pain, various forms of brain fog, and other neurologic symptoms. Very unpleasant and can be quite disabling. And then the second reason to recommend getting the vaccines rather than waiting for herd immunity is that if you wait and end up getting COVID-19, you potentially could transmit the infection to someone else. By contrast, there's increasing evidence that the COVID-19 vaccines do just the opposite. They reduce the risk not only of disease, but reduce the risk of acquiring the disease and transmitting it to others. So those are two very good reasons to go ahead with recommending the COVID-19 vaccine rather than waiting for herd immunity.